The Ghana Association of Medical Laboratory Scientists has raised concerns over an outbreak of cerebrospinal meningitis (CSM) in northern regions. CSM is a life-threatening disease that affects the protective membranes around the brain and spinal cord.
These are pathogens, right? Bacteria that have niche for a very hot environment, harsh condition, where you have dust, wind blowing and stuff like that, and we see this usually within the Harmattan season. So between December to about June, that's the space of time that you normally see this pathogen. But usually it peaks from December to about March, because that's when we have the Harmattan season. We have very dry, hot, humid environment, and it's conducive enough for the pathogen to thrive and for it to be able to reside in this membrane and then cause the disease that we are seeing.
Over 50 infections have been recorded in the northern region, with 10 deaths, according to the Ghana Association of Medical Laboratory Scientists. Public Relations Officer of the association, Dr. Gloria Amegache, highlighted the urgent need for increased support to laboratories in affected regions.
There's a need for us to be able to cover our nose and mouth when sneezing and coughing, so that we can curb the spread, impede the spread of the pathogen into the atmosphere, and also avoiding coming into close proximity with an infected saliva. So using cups, sharing spoons and stuff like that, you can come into contact with an infected saliva and you could be infected. So there's a need for us to avoid all those things, and then washing of hands with soap and water is very, very important.
The association is also calling for stricter infection prevention measures within healthcare facilities and a nationwide public education campaign to raise awareness of CSM symptoms and the importance of seeking early treatment.
We have the medical laboratory sciences and all, the pharmacy, the nurses that form the medical team, together with the public health, group and all that. So yes, the expertise are there. The individual, know-how is there. The logistics to work with, we also have it. But definitely, if the demand is more than the supply, then there will be a problem. So there should be enough of the logistics that we need for the identification of these pathogens in biological samples, so that we'll be able to meet the needs of.
As health authorities monitor the situation, the medical lab scientist is advocating for long-term investment in microbiological laboratory infrastructure to strengthen Ghana's ability to respond to future outbreaks.